presentation number 3. This is Kelsey Galantich. Kelsey Galantich is an attorney from United States who has been working with the World Organization for Animal Health Veterinary Registrative Support Program since June 2019. She has a Juris Doctor from the University of California College of Law, San Francisco, former UC bachelor's degree from Ability. She has experience living and working in North America, Europe, Latin America, and for the last 3 years in Africa. Her specialty and passion lie within the international environmental law, and more specifically, veterinary law and registration. Welcome, Kelsey.
Thank you, Simon, and good afternoon, everyone. I'm happy to present to you the results of a review of legislation on the regulation of veterinary professions in Africa, which David mentioned, and more specifically, some of the sub-regional results for Eastern Africa. So first, the objectives of this review were to determine the legal basis for the regulation of the veterinary professions in Africa, and more specifically to identify key gaps in legislation relating to VPPs and community animal health workers, notably some of the key elements to be included in legislation that Anne-Marie just went over. Also, one of the goals was to generally inform national and regional policymakers and legislators of the strengths and weaknesses in regulating the veterinary workforce, both within the region and also ideally some of the sub-regions. And of course, to support the ongoing activities related to workforce development that WOA has in Africa, specifically PCTAD, the AFDP3V and DITRA projects. And then also to offer suggestions for the reform and modernization and harmonization of legislation in the region and subregions. In order to conduct this review, I first went over the WOA PVS pathway reports for any discussion of the regulation of the veterinary professions. And this includes WOA PVS and also GAP and Veterinary Legislation Support Program reports. Then just a simple online research of the legislation for each country. And then between what was found within the WOA PVS reports and also the online research, each country's WOA delegate was emailed just to verify that the legislation found within this research was up to date. Then each country's legislation was reviewed according to a list of essential elements for the regulation of the veterinary profession, which were all derived from the WOA Terrestrial Animal Health Code, and also just in collaboration with the priority topics of the WOA Workforce Development Program. Then each country's results was tabulated in an Excel document, and a final report was generated of the overall compliance of the region with the essential elements. And there were also individual country assessments conducted, which are available. So please feel free to follow up with me afterwards if you're interested in seeing your country's results. So here are some of the essential elements for the regulation of the veterinary professions that were specifically looked for within the legislation. And I won't read them all to you, but essentially it's certain definitions, definition of veterinarian and veterinary practice, and also VPP, prerogatives of vets and VPPs, minimum and initial educational requirements and competencies of vets and VPPs. Generally also recognizing VPPs in the legislation. So that means any mention at all of VPPs in the legislation. There were also some elements that we looked at related to VSBs, including generally the legal basis to create a VSB, and of course the authority of the VSB to regulate both veterinarians and VPPs. So for that one, we specifically looked for a mandate in the law for the VSB to regulate both of these categories of workers. And then also whether or not there was a requirement for VPPs to be supervised by veterinarians, and for licensing and registration requirements. This list of essential elements, of course, isn't exhaustive. We also took note of other essential elements for regulating the veterinary profession that could be found in legislation other than the legislation specifically regulating the veterinary profession. So this could be laws around medicines, or also educational laws. So, for example, whether the prescription requirements of veterinary medicinal products by veterinarians and also by VPPs, or the legal basis for VSB to play a role in education. These could all be found in other types of legislation that were outside of the scope of the review that we conducted. So here are some of the general results. Overall, there were 119 pieces of legislation collected and reviewed, 52 pieces of primary legislation, and 67 pieces of secondary legislation. And when we say primary legislation, we're talking about an act of parliament, some kind of like a law. And secondary legislation is referring to regulations or implementing legislation. And within Eastern Africa, there were 10 pieces of primary legislation and 6 secondary. Overall, it was a really great response rate. 50 out of the 54 countries surveyed responded to the email asking for them to validate the legislation collected. 82% of the countries surveyed from Eastern Africa. 40 out of these 50 responding countries have primary legislation for the regulation of the veterinary profession. 7 out of the countries in Eastern Africa. 32 countries have a specific Veterinary Practice Act. 8 regulate the veterinary profession under a broader act. So that includes a general animal health law. And then only 18, or 45% of those with legislation actually have secondary legislation or regulations to support the implementation of the primary legislation. And then interestingly, we didn't actually ask for this information, but 24 out of the 50 countries that responded let us know that they have at least one relevant draft law in progress, 7 in Eastern Africa. So lots of work going on, work in progress, at least at the time of the email survey. So here is an overview of generally the percentage of essential elements that are typically found within the Veterinary Practice Acts that were found. So in the region, it was about 50% of countries had 15 or more of the 21 essential elements that I just displayed. And then in Eastern Africa, it was even more. So generally, the legislation is pretty compliant, but it is worth noting that there's still 50% of countries in the region that don't have, that have less than 14 of these essential elements. And here's a snapshot of the sub-regional results. So there's some slight variation, but overall there wasn't tremendous variation among the sub-regions. Eastern Africa was one of the highest. Here's another snapshot of the elements that were most widely included within the legislation. So the top 4, it was creation of a VSB, minimum initial educational requirements for veterinarians, registration authority of the VSB, and qualifications for veterinarians. Here are the results for Eastern Africa compared to the regional results. So you can see Eastern Africa outperformed the region in some of these areas, and then other areas it was lower, but there were nothing too shocking. Everything was relatively consistent. I circled the ones where the Eastern Africa results are slightly lower. So you can see veterinary minimum initial education requirements, veterinary prerogatives of veterinarians, and a legal basis for establishing a code of conduct. Here are the results that didn't perform as well, the essential elements that weren't included in as many pieces of legislation. And you can see a lot of them do relate to veterinary paraprofessionals. So 43% of countries, for example, included a legal basis for the minimum initial education requirements of veterinary paraprofessionals. 38% of countries included a definition of the of VPPs in their law. 35% of countries had a legal basis for the VPPs to be supervised by veterinarians, and 30% of countries had a legal basis for the VSB to regulate both vets and VPPs. And here are the results for Eastern Africa compared to the regional results. So again, relatively consistent. The Eastern Africa outperformed in a couple of these. 100% of the countries had a definition section and defined veterinarians. And here the results for VPPs that I just listed are a bit higher, but still lower than those for veterinarians. And it's also notable that Eastern Africa, 29% of the countries had a legal base or included enacted secondary legislation, and 43% included VPP qualifications. So, but again, relatively consistent with the regional results. And again, 45% of the countries with legislation for the veterinary professions enacted secondary legislation to implement the primary legislation, and that included 28% of those responding from Eastern Africa. And this is really crucial because where some of the elements might be included in the primary legislation, they might not be fully covered because sometimes the primary legislation said that there was a legal basis to enact implementing laws for the certain elements without actually implementing it. So because there was no secondary legislation. So for example, 72.5% of countries have a legal basis to establish a code of conduct, but then only 38% actually enacted the code of conduct in practice. So that effectively has, that means effectively that the code of conduct element isn't fully covered in the legislation. Here's a comparison of the elements relating to VPPs and veterinarians. So you can see where 4 out of these 5 are 90% or above for veterinarians. Many of them are less than 50% for VPPs. So this includes 43% of countries with a legal basis to regulate or for VPP minimum initial education requirements compared to 98% of countries for veterinarian minimum initial education requirements. And it's relatively the same for qualifications of vets and VPPs and prerogatives of vets and VPPs. And of course, what we already talked about, but the legal basis to create a VSB, but then only 30% of these countries with a legal basis to create a VSB have a legal basis for the VSB to regulate both veterinarians and VPPs. And here are the Eastern Africa results. So again, pretty consistent with the regional results. It's a bit higher for some of the VPP elements. So 7% of the countries in East Africa include a definition of VPPs. And 57% of the countries, have a legal basis for the VSB to regulate both veterinarians and VPPs, but again, still lower than some of the requirements for veterinarians. We also took note of whether or not the legislation mentioned community animal health workers. So 5 out of the 40 countries with legislation for the veterinary profession included some kind of legal basis for the regulation of community animal health workers, 3 of them in Eastern Africa, but this is still only 13% of countries that were responding. And this is pretty significant because according to a survey conducted by the Regional Core Group for Africa, 81% of countries in West Africa, 58% in Southern Africa, and 57% in East Africa reported that they use these workers in practice. So this was a pretty significant finding. But again, some of, as noted on this slide, some of the legislation that could regulate this category of workers could be just outside of the scope of this review. So this is purely within the legislation, specifically regulating the veterinary profession. Here's a comparison of the elements relating to veterinary statutory bodies. So you can see most of these elements are included in the legislation reviewed, 85% or above. But then the outlier is the 30% of countries that have a legal basis for the VSB to regulate veterinarians and VPPs. And these are consistent with the Eastern Africa results. Sorry, this isn't moving. Next, okay. So Anne-Marie mentioned some of these key concepts for legal drafting and for drafting legislation that is clear and easy to follow and implementable. And some of these trends were observed and taken note of during this review. So there were a lot of duplicated provisions among the pieces of legislation for certain countries. A lot of times, like we just discussed, elements were left to secondary legislation without actually enacting the secondary legislation. Sometimes there were terms defined and then a different term was used, which again, as Anne-Marie was just detailing, this left a lot of confusion as to the meaning of the term and what is meant to be covered in the legislation. Often veterinarians and VPPs were mentioned together. And then there was often also, along with that, an ambiguous definition of veterinary practice, which effectively had the effect of creating no legal distinction between these two professions. So this is an example of how definitions really are crucial for helping to understand the law.
Kelsey,
Then,
the time is up, so please wind up.
Okay, well, this is the last slide. So again, here are some of the key takeaways. VPPs are generally underrepresented and underregulated in legislation compared to veterinarians. And of note, most countries lack a legal basis currently for the national VSB to regulate VPPs. And legal clarity is important, particularly given some of the trends I just went through with you, for ensuring an effective legal basis for addressing the key issues and making sure that the enabling essential elements for the enabling environment are covered in the law. And many countries could benefit from efforts to clarify and define and consistently use these essential terms, as well as from creating secondary legislation to implement the primary legislation.